would like to invite an interlude of poetry, just a freestyle, to at least keep us going, because we don't want you people to get bored, because we know probably we do a lot of learning in this department. So yeah, for today we want to just invite, and this person is actually a fresher. This is to tell you people that being in public health department actually does, or being in the sciences does not mean that you cannot express yourself. You see what just went down there? You see how he was expressing himself? I am inspired. Somebody would have thought, oh, is he a social science student? Because as science students, we are supposed to stand on stage and not know what to say. So I hope that cycle is broken today. So can we please invite on stage Miss...
Good afternoon, everyone. Okay, my name is Mariama F. Damo. Okay, today I want to recite a small poem, and it will not just be limited to a poem. Along the line, we will sing a little song that will just entertain everybody here. So let's start with the poem. It goes like this. Changes, changes, changes. I need changes. You need changes. And collectively, we need changes. How can we achieve this change when our leaders are not ready to change? When our leaders are silenced because they are satisfied, while their followers are perishing gradually by the day. The youth are suffering because there is no employment opportunity. Many youth engage themselves in stealing and robbery because they are forced to do so. That is why we have so many mad people rolling in the streets. The unimaginable killings are becoming unbearable. This is because we have weaker security. How can we have strong security when people who are secure are not secure? When everyone is out there for themselves and their family, forgetting their responsibilities, forgetting that responsibilities come first before anything. The maternal mortality rate or infant mortality rate is becoming unbearable. This is because we have poor medical facilities and many young illiterate are employed in our health sectors based on connection. So tell me what is the use of qualification in this country when people who are qualified are not quality? The women are complaining every day in the market because the price of items are increasing by the day. So changes is what we all need. Let's start now, and collectively we can achieve it. Thank you all. Okay, now let's go to the song part. It goes like this, and this one is going to be dedicated to the executive members. Okay, now, like when I call a person's name, I will start like if I said, Daudanata Sapela Jallo Lenata, then all of you will say, Sapela Jallo Lenata. Let's go. Okay, let's start. Jango Lenata Sapela Drame Lenata. Adam Lenata Sapela Daule Lenata. Use Lenata Sapela Balde Lenata. Basek Lenata Sapela Seni Lenata. Bakar Lenata Sapela Bale Lenata. Lamin Lenata Sapela Jata Lenata. Maimuna Nata Sapela Galle Lenata. Use Lenata Sapela Balde Lenata. Janko Lenata Sapela Grame Lenata. Ramzi Lenata, Sapela Jallo Lenata. All right, thank you so very much.
Have talent in SAPEH, right? Because if I'm to tell you, this lady here was not even informed that she was supposed to perform here today. Imagine she was informed and she had days to prepare for this. Because I just came in and when the speaker was already on stage, I decided to call her and now say, can you please come up with something and just entertain us? I was not expecting that. Thank you so much. We definitely have talent in SAPEH. Let us clap for that. So now it's back to business. I mean, even the entertainment did contain a lot of inspiration for me. That poem was very, very wonderful. And I would like to invite our next speaker. So this next speaker is going to be talking to us about career paths in public health, how to make informed choices. This one is an award-winning public health practitioner. Can we please clap for that before I even move forward? So this man is an award-winning public health practitioner and epidemiologist with over 9 years of experience in disease surveillance, outbreak investigation, immunizations, and health system strengthening across the Gambia and West Africa. Literally everything that sums up the public health profession. He currently serves as data manager and statistics associate at PATH International, leading malaria data analytics, dashboard development, and cross-border collaboration to inform policy and program decisions. Ladies and gentlemen, this man has held pivotal roles, including vaccine safety training coordinator with A, AE, AFENet slash CDC. I think that means Center for Disease Control, Senior Health Information System Officer at the Ministry of Health, and Head of Contact Tracing at the Public Health Emergency Operations Center during COVID-19. He has also his leadership extends beyond technical practice. He is the president of the Association of Public and Environmental Health Officers in the Gambia, former Gender and Health Minister of the UTG Students Union, and Secretary General of the Student Association of Public and Environmental Health, where he has championed professional development, gender equity, and community health advocacy. So this man is literally not new to this. He holds a Master of Philosophy in Applied Epidemiology and Disease Control from the University of Ghana, a Bachelor of Science in Public and Environmental Health, magna cum laude, from the University of the Gambia. Let's clap for that again. And an HND, distinction from the Gambia College. His scholarly contributions include peer-reviewed publications on vaccine timeliness, digital surveillance systems, and malaria epidemiology. Ladies and gentlemen, if diversity were a person, if diverse were a person, I think it will be these two gentlemen sitting before us today. Recognized nationally and internationally, he has received multiple honors, including the Emerging Leader in Public Health Award, the Public Health Champion Award, and consecutive Best Public Health Officer of Year awards. Ladies and gentlemen, like I earlier said, if you are present in this room today and you do not live inspired, then I do not see what in this world is going to inspire you today. The 13th Executive Council of SAPEH has really outdone themselves by by not bringing you just any individuals, but by taking their time to fetch you the very best. And you've had all their qualifications, right? One would think somebody in their positions, I mean, what are they doing here? In a small department like SAPEH. And today is a Monday, by the way. That tells you a lot about these individuals. And I'm not just inspired because of how many achievements about them I have listed, but I'm inspired because despite all of their achievements, they are so passionate about giving back. They are so passionate. They are here today. It's a Monday. I mean, I know that they have other engagements, but they've been so patient. They are here to talk to us, to inspire us, and I mean, could it be any better than that? When the first presenter was speaking, you could see the smile on his face. And you could really tell that this is somebody that is not just doing this job, but this is somebody that really knows what he's doing. And most importantly, that loves what he is doing. That says so much to me. And I hope it does to you too. So please, let us invite our next speaker, current president of the Association of Public and Environmental Health Officers in the Gambia, His Excellency, Mr. Sajaja Dufi. Thank you so much for being here, President.
Good afternoon to you all. I am happy to be here, right? Yeah, because SAPEH is something that we always have at our mind. And indeed, it has really contributed to our growth. Bakariru here, my colleague, who is the vice president, was one time the president of SAPEH. And we all play our part, and we continue to play our part. And there's one thing, okay, before the okay, finally, this slide is up. So, I think, yeah, good afternoon, Mr. President, and the entire staff executive, the students present here, and of course, my colleague, the Vice President of Public Association of Public Health Officers in the Gambia, and also the President of Epidemiologic Society of the Gambia. I'm happy to be here, and my presentation today is going to be short, and I want it to be interactive. Whilst you are enjoying your breakfast, please lend me your ears also, right? Yeah, and if you can reduce or minimize phone usage, at least so that we can have an interactive conversation. So on the topic that is career path in public health and how to make an informed choice. I hope there is no one here who was forced to apply public health. Was any one of us forced here? Anybody in the room that was forced to apply public health? Or you made public health to be your second choice? I know, yes, we have people. No need to raise your hands, but like public health was never the first choice of some of us, right? But I can tell you that you made the right choice by choosing public health, and you are not going to regret it. Yeah, so this is going to be the outline today: public health, local and global context, some of the career tracks, and how to choose your career path, and how you can build your profile, the success stories, and salary insights. And we have key insights, questions, and answers. Yeah. So why public health first place? We all know the definition of public health, right? Huh? If you don't know the definition, you should go back and return your people's fare that you are paying to Faraba. Yeah, so our role is one to protect and improve the entire health of the population. If we succeed in our role, then our other sister carers will not have any work to do, right? If nobody is sick, nobody is going to the hospital. And we are going to save money, right? So why are people getting sick? Because we fail in our role. Did we fail in our role? But people are getting sick, and we said we want to prevent disease. Protecting the earth. What? We are trying, right? Yes, so yes, that is the objective, like for nobody to get sick. But whatever happens, even sometimes, like things happens, right? Even if you are healthy, eating healthy, doing all the precautions, there is a time that will come, like your time is going to get expired, right? And even if you try to avoid it, certainly it comes, right? So that's why public health matters. And if you look at the global scale, we have up to 8 billion people, right, that are living in this world. That is a huge population. And as public health officers, we serve what the entire population. So that is big. And according to WHO estimates, by 2030, we are going to need more healthcare workers, almost over 11.1 million healthcare workers are going to be needed by 2030. Because when COVID-19 came in, it affects both the healthcare workers and non-healthcare workers. So there is an existing gap that you and I need to fill. And it is one of the growing sectors also in the developing nations because we know that if we want to specialize on individual cares, it's going to be very difficult for us. The money that you spend if you are sick and you are from an underprivileged family, asked to go to AfriMed, Medicare, or the private health facilities, the test alone that you might, even to see a doctor, the consultation fee is $800 well before you are seen by a medical, and you have to pay that one first. So someone like me, if I want to do that one, it's going to be very difficult. And government always complain that there is no resources, right? So that's why it is a growing field. Like, why not we invest in preventive medicine so that we can be able to avoid a lot of cases. At the end of the day, we will not spend much money. And the impact of public health is infinity. It is across what? Generations. Anytime, whether we are here or not, they are going to need public health officers. The world is going to need you, and you can work in different parts. So, public health, it is not just a career, it is a calling to serve what? Communities and drive what? A meaningful change, right? We are change agents. Anywhere you go, your impact will be felt, irrespective of the situation in the country. Treat people with care, love, and respect. So, understanding the Gambia landscape, this is our profile, right? According to the GBOS estimate, we have 2.4 million, right? Our population, right? It's 2.4 million. And this estimate is from WHO, although it applies to the number of medical doctors that is needed per 10,000 population. So I quickly, roughly estimated to public health. The minimum is 10 per 10,000 population. So I assume that we have 1,000 public health officers that are working with the Minister of Health or the government. We have 1,000 public health officers in the country. We are not up to that, but this is a rough estimate. And even with that, we fall short of the minimum estimate by WHO. And we have diseases that we are battling with, such as malaria, TB, diarrhea, malnutrition, maternal mortality, and of course, this is undernutrition, that is the under 5 stunting, with the multi-indicator cluster survey conducted by UNICEF. It found out that 31% of the children are stunted, they are undergrowth. So, and some of the key opportunities that lies in Minister of, in the Gambia for you, Minister of Health, of course, the Directorate of Public Health serve as the sole employers of public health. We also have international NGOs in the country, such as WHO, UNICEF, PAT, ActionAid, and also community health centers such as the Environmental Health Promotion Outreach and academic and research institutions involved, the MRC and QTD. So now we want to explore career paths. Although the career paths are many, and Mr. President has spoke about the career paths in public health, and I just list 6 career paths that I want us to focus on. And of course, he mentioned the epidemiology and then the research, right? Where you can do what disease surveillance, outbreak investigations, and what statistical analysis. You have health promotion and education, where you can conduct community campaign, behavioral change, school health programs, and we also have what global and international health, such as the NGOs, you can focus on global health, and you might find yourself in these institutions, the WHO, USAID, and the list goes on. And we have what health policy management, that is governance, ministries, health administrators, and planners. You can be environmental health officers responsible for water sanitation, occupational health hazards, climate change, and community and social health workers. You can work with NGOs, community clinics, and conduct outreach services. So the list is many. These are just few career tracks. We have biostatisticians, the M&E specialists, are all areas that are within the public health. And you should be able to at least fall in love with at least 3 or 4 or 5 different areas. Make your scope wide at the beginning. As you grow, you narrow it, right? I think you guys did the Maslow hierarchy of needs, right? Mr. Diva taught you guys. Huh? The pyramid. Or yeah, so quickly, this is just a comparison about the clinical health and public health. How a clinician, someone who is a nurse, a medical doctor, or a public health practitioner. So our focus is on what the entire population, while the clinicians they focus on what individual patients, right? There are settings they work where in the hospitals, clinic wards, and whilst we work in the field, sometimes we work in the office, and sometimes we work at policy level. And I don't know whether that is the reason why most of the offices at public health centers are small, because maybe they feel like we don't have to stay in the health facility, or we don't need that big space, huh? But anyways, that's a joke. You should have a comfortable office. So our core tools is what? Data, prevention, and what? System change. So their core tools are what? Diagnostic and treatment. But now you go to facilities, you see public health officers wearing gowns, and you can't even differentiate them between a clinician and a public health officer. And trainings, they undergo trainings such as bachelor's in medicine, in community health, nursing, primary health care, whilst we have BSc public health, master's in public health, epidemiology, environmental health, and their key skill is what? Clinical decision making. For public health, what is our key skill is what? Research, communication, and what? Advocacy. The impact scale, now if you look at it, you are just dealing with one person at a time. That is the clinicians. And for you as a public health officer, you are dealing with what? Thousands or to millions simultaneously. And that's why if you are posted as a beginner in public health, you are posted to a health facility and you are responsible for an entire catchment area that can go up to 200 or 300,000 inhabitants. And any decision you make is going to have a bearing on those people's their life. So that's why it is very important. If you are making a decision, let it be based on data, and let it be something that can impact a meaningful change in that society. So this is a skill matrix of which career path fits you very well. If you are thinking around epidemiology, obviously you must be very good at what? Data. And you should also be good at what? Statistics. That is of a high priority. For communication, it is a skill, but yeah, it should be on a scale. When I was developing this, should it be on the higher side or the low side, depending on, yeah, if you are able to generate this evidence, even if you are not a good communicator, Because if you work in a team, you should be able to have someone. So I categorize it as something that is low. Lab and science, if you conduct your, for you to be able to confirm an outbreak, to verify it, you should do what? Laboratory confirmation. Don't say that, call your colleague, hey, hello, Fatu, go. Dalla yang na outbreak la soto karu mo ni na jang amari en la soto measles outbreak will be in Jupiter la kanana without having any evidence. So the science part should be back and also the laboratory. For policy writings, you are not an policy experts, medium, and then community work because you are dealing with the entire community. That should be high. And also, leadership is very key because if you are an epidemiologist, especially working in the field, sometimes you will have outbreaks and you are going to be what the team lead for that outbreak investigation. So if you don't have leadership capacity to be able to manage a team, and so that's why this is an advice. All of you should be leaders before you leave this institution. Because at least if you have that leadership skill, don't tell people whether we like it or not. It is a natural role that we are going to assume. We want to be fathers, right? But we are brothers and sisters at home. We have siblings that look up to us. So that is even leadership, right? So leadership is part of everybody's life. And people say that like, okay, for me, I'm not good at leadership or I'm shy. It should be the thing of the past, please. If you are a student, you should be outgoing, think of crazy things. If you are someone who don't feel comfortable to talk to at least two or three people, start talking to mirrors. I used to do it. I talk to a mirror. I'm not mad. Yeah. So I talk to Miro to see, well, how am I communicating? Am I communicating well? Or like at least receive genuine feedback from myself. Because if I am talking to Miro, I will know how my hand gesture is, how I am moving my mouth. And yes, and if need be, attend leadership clubs, join them, volunteer so that you can at least build on your leadership skills because it is a continuous thing that you have to learn. And one day or the other, you might be surprised. Someone may just pick up your hand for you to be taking that leadership position. So for health promotion and education, data is medium priority. Communication is very high. You need to relate with people. And yes, my brother, can you share with us? Yes. Yes, I'm very interested in the conversation. Yeah, so like health promotion, global health, policy management, environmental health, community health, and social work. So this is a matrix where you need to fill out, is it a high priority area? Like I am interested in policy. Well, if you are interested in policy, you should be someone that should be able to deal with science because you are dealing with a lot of papers, things that are going to affect the life of 2 million people, developing strategic plans, the national health policy, and all other programs that operates within that one, setting a goal that at least by every 5 years we should be able to achieve all these goals within the sustainable development goals. So now, how are you going to choose your career path? This is an individual decision, but at least with guidance, you can be able to make an informed choice. And we break down the steps into three. The first step is what you should know yourself. No matter how people know you, you know yourself better than anyone. And even our parents, we know ourselves better than anyone. And you should be able to first identify what problem do I really want to solve. Are you someone that is drawn to research, people, or policy? And what are your academic strengths? Understand that one. Start listing them. Am I someone that, okay, oh, yes, I'm from Makatia. All right, okay. We've seen that. Okay, CRR being the most remote community in the country, we have a lot of malaria cases. I'm interested in solving malaria. How am I going to solve this malaria? What is the data telling me? How many people are dying of malaria? How many people are getting sick? So you know that, okay, fine, you've identified an area that you are interested in. And now what? What is my academic strength? How well am I performing in biostatistics? Oh, Mr. Manjali is very difficult. That man, he don't smile. And even if it is 11 o'clock, he's in class. Whether one person is here. No, always I'm having problem with Manjali. I don't think I can cope. No, epidemiology, Dr. Cisse, that man, eh, where that man said questions. It's crazy. Sometimes you think he's even angry with us, huh? So like, so fine person. But if you are someone who is always smiling when Madam Evening comes in, maybe you are interested in nutrition component or the waste management component or other lecturers, and you fall in love with those ones, take a grab of that place as your strength. And say that, okay, based on this, I think I can be able to do that one. So the second step is what? Explore the field. Shadow professionals in different roles. Because if you are a beginner, it is good not to confine yourself. Yeah? Session areas early. Don't wait until you are old and you start saying that, like, oh, in fact, I want to do this because I'm the only person who is working in my family. So I want to take care of my siblings before I start studying. No, I want to think of these things. The more you start considering that one, time is going, like if I remember the time when I was here, I was young, and now, unless I was not having any beers, and now I'm growing beers, and I come to think of it, when was, oh, that's, so like if you did not plan early, obviously, every day that we lose in our life, we are never going to get it. So you need to plan strategically. Seek internship and volunteer roles. If you finish your school, don't wait for the government to come for you to employ you. You are going to the field to do your practicals in all public health units. We know it's difficult to be without on salaries, but sitting at home every day, if you are like me, you want to drink a tire, you want to know what Fabrizio Romano is talking about on sports updates, or a fan of basketball, you want to think on all those things, but you volunteering going to that health facility, at least you are going to learn one or two things for that day. Though if you cannot go every day, at least in a week, try it twice. If that is too much, just once in a week. Let it be productive. Voluntary roles in all our communities, we have these youth-led organizations. Community participate in that one. And Baseto is here. If you want to join, if you want to be a volunteer, Red Cross, you can join. And we have links everywhere, like you can do those things. And with that, if you are volunteering, you are going to learn skills and you are also going to network and build a diverse skill portfolio. Yes. For instance, you said, okay, I am an epidemiologist. I'm responsible for investigating outbreaks, response, and other things. So for me, I'm just going to focus on field investigation, outbreaks, writing reports, and you don't want to build communication skill. If you are asked for you to go on TV to conduct an interview and you start dragging kids, telling people that no, for me, I am camera side. I don't want to do that one. So don't just say that, okay, for me, this is my way. I just have at least apply a bit of what flexibility, diversify your portfolios when it comes to skills. We were not mathematicians, none of us, but we find ourselves in epidemiology. I can say that I'm not a biostatistician, but now at least You know, if a biostatistician is talking, we can be able to, yes, whether the person is misleading us or not misleading us, at least we can be able to know that, yes, what this individual is doing, at least, yeah, what he's saying is at least factual or not. You can be able to do that one. But if you don't diversify your skills, it will be very difficult on you. And even if they are telling you something that is even important, you will say that like, oh, this is not even important. It's just a small thing. Or people ask you doing an outbreak investigation, oh, we just lost 3 kills. Every number is what significant, right? So which public health track interests you most? I want you people to answer this question for me. You can raise your hand and call out your answers or keep it up. Huh? Which area interests you most? Your name, please. Your name. Huh? Genoa. Which area interests you most? What? Number one. A. All right. Yes, my brother with the laptop. Which area interests you most? Huh? You are a computer science student. Yeah, you can be a data engineer. Huh? Yeah, so like at least try and have an area that interests you most if you are in the school because you are doing a lot of courses, right? How many courses are you doing before you finish your unit? Is it up to 40? 40 plus courses, right? The department requirements and the GRs, if you sum them, it's going to be around 40. You cannot say that like, oh, for me, I don't have any area that interests me. Then people will question you, why do you even come to university? Right? Oh, you are interested in all the 40 subjects. Then, my brother, something must be wrong with you. For only 40 courses of plus you are interested, you want to be an expert? You cannot finish reading all those areas. So this is just a day, a day in the life of an epidemiologist where you wake up early in the morning, you review overnight disease surveillance data. And as public health officers, we do these things. Weekly surveillance, you submit it to your supervisor by 10 every morning on Mondays. You also want to conduct what? Field investigations, you want to do what analysis of your that data and you write what reports, the situational reports to give updates, especially when you are in an outbreak mode. That's the time you write every day. Huh? Health promotion officers, community radios, sessions, school health sessions. You design information communication materials with the communication team, and you evaluate behavioral change programs. It's important we do programs, but what is the impact of that program also matters. Oh, I conducted 50 radio talks. So did anybody listen to your program? Were you able to change at least a behavior of an individual also? And as a health policy cabinet briefings, this is where the minister, the directors, some of them sit, stakeholder meetings with WHO, policy recommendations, review impacts, and yeah, this one is building your public health profile. So in building your public health profiles, it is important for you to do a practical step to become what? A productive candidate. The world we have up to 8 billion people. And you are competing with all these people. So how can you be a stand-up? If a job is advertised today, 100 people are going to apply or more, right? And this year, I think university recorded the highest number of graduates, over 1,600 for a small space. So everybody is going to apply, people with the Summa, Magna, the cum laudes, honors, normal degree, or whatever, they are all going to apply. And but if you have your academic excellence, that is going to at least put you in the ring. Sometimes you can have it, and sometimes you may need a bit of luck to be able to get that one. Not every rejection means that you are unqualified. Sometimes things happen out of love, right? I hope you don't have philosophers who will say they don't believe in love. It does exist, please. Yeah, so if you build, all right, thank you. You know, I like talking, and thank you, Wesley, for reminding me. Yes, so build an academic excellence, specialize in areas that best fits you, gain research experience, participate in research. Even the University of the Gambia Student Union do conduct research competitions. Submit your names to be in the research competition. And now the university is doing masters. If you have master students or your own thesis, take up the challenge, work on it. At the end of the day, publish your research. So once you take part in the writing of your, even to come up with your research topic alone gives you a lot of headache, right? How do you start? You start thinking, oh, I'm interested in malaria. But now, hey, malaria is very broad. Now, how are you going to construct your research topic? There you start thinking, knowledge and practice of models on malaria. No, but that one is not nice. This, you go to Manjari say that, no, this, you can't conduct research on this. You have to change. So like even with that struggle alone, writing your research proposal, going through the methods, the data collections, analysis, writing the final one to come on stage to even defend it. That alone is a wealth of experience where you can also serve as a guidance for others. And of course, networking. Join professionals, attend trainings or webinars, because with the interaction today, at least if I go home, I can say that, okay, we have someone that is good to MC programs, or we have someone who is a poet, or we have someone who is talented. So like, that's where everything starts. And also do volunteer some of your times to do what some certification courses. There are free courses that you can do through the WHO course. Of course, the CDC, the field epidemiology program, you need to apply that one through the ministry, voluntary and communication, and also what learn digital skills. The president made it clear that he learned Power BI online, YouTube. So the amount of time we spend on TikTok, other sites, we can divert it to what? I want to learn how to create a dashboard in Power BI. I want to learn this skill. Today I want to do communication. Oh, I want to do how to calculate using the 4 by 4 table. And the more you learn, the better you become. So your roadmap in 10 years time, if you graduate maybe year zero with a PhD in environmental health, within 1 to 2 years, you will be at the field. And that makes the entry level. We all start at the field, right? As public health officers, health facility. Then, depending on the career trajectory, within 3 to 5 years, you may find yourself at middle level, becoming specialist or analyst or team lead roles. You may become tax officers, and the list goes on. Between 5 to 7 years, you become what? Senior program officers with your master's program, and within 8 to 10 years, that's where you assume the directorate levels. If you have your PhD, you become program managers, directors, and the list goes on. And this is an estimate. It is not, might not be the actuality. People don't reveal their salaries, right? So people, right? But at least this is the minimum expectations between local, the government, and also what international organizations. So the charts you can see more money is in the international organizations, but it is always important to start from somewhere and aim high. And the common mistakes to avoid is the choosing by default, not design. Choosing is by default and not design. Many students pick public health without reflection. Audit your interest early. Passion sustains what? Long career. Because if it is monetary gain, you might pick a job that pays very well. There can be a problem, like the USAID funded stuff. Some people lose their job. But if you have a passion for something, whether the money is there, the reward, you are just passionate about it. You just want to do it. Every day, if you are someone who is an attire addict, whether people motivate you or not, you brew attire, right? Even if you are tired. Sometimes attire will even call you because some people will have headache. And they say, if I don't take attire, I will not be cool. So if you are passionate about something, you just do it voluntarily. And ignoring digital skills. The soft skills are very important. Don't say that, oh, I'm from CRR, we don't have laptops. I don't know how to operate laptop, or I'm afraid of laptop, the keyboards. They're not going to kill you. Even if you type by searching, oh, where is A? A is here, B, O. Don't be afraid of it. Learn skills, learn the software analysis skills, the soft skills, even the communication, leadership, and skipping further education planning. Make your plans. As you are exiting from the university, start thinking, okay, in 3 or 5 years' time, I want to do my master's. Oh, I want to get married. Yeah, it's important, but I also want to do my career. How am I going to balance it? Oh no, let me get married. Later on, my kids can do the education for me. Don't kill your dream because at the end of the day, you are going to regret and say, oh, now Binta is now a doctor. And I was in the same class with Binta and you start regretting. So don't skip your further education plan. Neglecting what practical experience. A degree alone is not enough. Employers want what? Field exposure, volunteer, intern, and engage in communities activities. Have you seen a job advert that they will, oh, we are looking for public health officer with zero experience? Always the experience part is there, either 5 years, 6 years, 10 years. It is always there that the work experience will be there. And sometimes you question, how are you going to get the job when you don't have any work experience? Why are these people even fellows? Huh? Why are they trying to put someone like me finishing school, they are asking for 3 years work experience? But you don't know that the voluntary job you are doing is also considered work experience. But if you are someone who is not volunteering, doing anything or internship, obviously you are not going to get experience. It does not mean that you have to be working in an established institution or whatever. Internship, the voluntary, they are all considered as what? Work experience. And underestimating networking. Many opportunities are not advertised. Build relationship through SAPEH, attend conference and professional association. At times you might be working in an institution and the HR can just contact someone that we have a role. Do you know someone who is a very good candidate that you think can do the job? Because, yeah, oh, I know a colleague. That person is very good. He can deliver all the deliverables for you within a short period of time. And yeah, can you ask your colleague to send his or her CV? The individual will send it, and the next day you hear that you get the job. And sometimes we even say whether these international organizations are they even advertising. Sometimes you will not see, you just hear someone is working there. So don't underestimate the networking component. Waiting to be ready. Waiting to be ready. Start applying, volunteering, publishing now. Imperfect actions beats perfect inaction in career building. We all make mistakes. But if you make mistakes, you learn. And that helps you. Because if you want to live a perfect life, you cannot be a mentor for anybody. For you, all you know is to follow instructions, whether it is wrong or not. But sometimes, at least, oh, don't go and steal people's mango. If you go there, especially, you might be caught. If you don't do that, what you cannot give those advice. So that is very important. And alumni success stories. We have a lot of people that pass through this course.
This man is currently serving as co-founder and chief executive of Modern Pay, which is a okay. Can we settle down, please? Okay, so he's currently serving as co-founder and chief executive officer of Modern Pay, a fintech platform building next generation payment infrastructure that connects African businesses to the global economy, leading cross-border payment innovation, solutions that enhance financial access, reduce transaction costs, and expand digital inclusion across West Africa. He's equally co-founder and chief data scientist of GoMinds, a pioneering data science and artificial intelligence consulting firm in the Gambia. I believe a lot of us, if not all of us, have heard about GoMinds Academy, haven't we? We have. Right. And then he's like I said, he's equally founded Gominds Academy, an edtech and talent development institution dedicated to training the next generation of data, technology, and business professionals in the Gambia and beyond. Through intensive industry-aligned programs, building pathways that connect young Africans to global opportunities, bridging the gap between education and employability. So in a nutshell, this man is somebody who is very passionate, and of course, all the people we've had here today are the pure examples of make your passion your profession. It's not just about do something because there's money in it. At the end of the day, I think if you do anything that is related to data and you do it right and you do it with passion, money will always come. I don't know which of the presidents say money will come, right? So money will always come. So at the end of the day, the reason why we had these people here today on a Monday is not just because they're good at what they do. It's because they're good at what they do, but also the reason they're good at what they do is because they love what they do. If they do not love what they do, I am pretty sure inviting them to come and talk to students about what they do and whatever, it's all going to be about the money for them, but they are very passionate about what they do, and that is why they left everything they are doing today to be here with us. When I went out to collect him, you'd be very impressed to know that when I told him, I was like, I'm so sorry, hope this is not inconvenient for you. He was like, you know, when you people call, we must be here to answer. Can we please give him a round of applause for that? We are so honored to have you with us today. You guys might not understand, but we took our time to get you the very best in their fields, and then we do not take it for granted. And the few of us that are here, I think this is a very big opportunity. You are very lucky to be here. So please pay as much attention as you can. If innovation was a person, if creativity was a person, it would be this man right here. I cannot tell you all of it, but please let us welcome the CEO of Go Minds and Modern Pay, Mr. Modi Jala, on stage.
And I will actually start it with a very interesting thing, especially the question that some of you guys ask. I love people asking those questions, especially if lecturers are around. I really love that. Good. So again, I will just start it off with three things. First of all, I was into the healthcare. I started medicine. I started in the medical school of the University of the Gambia. Then I realized that it was not for me. Then I left. Then I got into technology. I actually did data science and artificial intelligence. When Gambia, people don't even know what AI is. That was 2015. And most of us really knew about AI, some few couple of years back, right? Then, of course, having the opportunity to travel outside, then I studied artificial intelligence, right? Always knowing what is definitely coming next. And finally, I am an entrepreneur. So I have actually gotten myself into three different stuff. I have been into the healthcare sector. I've actually been into, computer science or technology and innovation. And now I'm actually into business. And these are three things that I've seen over the last decade. I've actually really did, quite a very good job on these things. And what does that has to do with the discussion that we have here today? I think, I can definitely see myself as that guy who keep on asking questions. Like when I was in uni, I keep on asking a lot of questions. And that was one of the reasons why I left medical school. And if you are a student, you are not bold. You will never be bold in your life. The only thing that you have been assigned to do is study and pass exams. Done. That is your biggest responsibility as a student. So if you cannot ask questions, if you cannot be curious, if you cannot go that extra mile while you are a student, it will never come in the face of the planet. It will not come. I've passed through that. I've seen people who have really passed through that. And you see, comfortability breeds a lot of issues that you will definitely have issue one day with. A bit of my time, I will speak as an entrepreneur. And I think I will start it off from that point. So speaking as an entrepreneur, I will actually design this conversation toward two parts. One part, taking you through as an employee. The other part, taking you as an employer. Meaning, the first part is taking you as preparing you to be employed by someone. And the second part is taking you through a journey whereby you don't wait for someone to employ you. You definitely have to do something to employ yourself. Not only will you employ yourself, but employ other people along the line. Sadly, the first part, this is what everyone will have to talk about literally every single day. When I was seated here, most of the conversation revolves around someone employing you. And you will be dumb enough as a university student to see every single individual that is graduating every single year. They are not getting jobs. And you think you will be exceptional. That is the biggest, you will be dummy enough to think you will be exceptional on that. Don't get me wrong, there will be some outliers here and there. But remember, how many people in fact left the country to study outside? Those people are coming back. How many of you will spend a lot of your time in university and at the end of the day, you cannot be absorbed by the government, especially public health? All the conversation here revolves around, since when I got here, all the conversation revolves around two things. Ministry of Health and then the Director of Public Health Service. Ask around how many of employees do those people even have? One. Ask that question first. The second and most important question is ask or investigate. It's very easy. Minister of Finance, they have the budget. You can download it. What is their budget capacity that they have? And why am I talking as an entrepreneur? I definitely know because I've investigated this. These are people that will be having projects. These are people that will be having, good deals out there. We will approach them with solutions. We know the conversation that we have with them. So, and then we definitely know how naive you will be just to stop at reading your books and passing exams. You will be so naive thinking learning will stop in the four corners of this class. You will be so naive to think the most important component of your education is your degree and your transcript. That is just 25% at most. At most, it is 25%. 75% of it has nothing to do with that. But again, you cannot be blamed entirely. Because if you don't know, you don't know. That's just it. And again, if you totally rely on people who went through the same system, for them to succeed, for them to tell you, you will be totally misguided. This is why every single, one of the most important things that we lack in this country is leaders who are entrepreneurial in mind. I can stand in the National Assembly and argue on this. If you have leaders who are not entrepreneurial in mind, this is still the problem that you have. And across all the institutions that we definitely have, these are the same problems that we have over and over and over and over and over again. But again, connecting it with the first part, please and please and please, make research beyond your class. Make research outside the ecosystem that you're in. Don't be like, okay, you want to know something, you ask your tutors, you ask your lecturers. Go out there, people who doesn't have anything to do with whatever kind of stuff that you're definitely doing. Someone should, at a certain point, someone asked me this question. Coming from Gambia, how did you study AI? I had only 4 options before leaving this country. I was like, okay, medicine is out of it. I'm leaving medicine. So I'm left with probably engineering and computer science. I went to NAWEC, made my research. Like, no, 10 years. Man, I don't want to be like those people who are working here. If you don't see yourself 10 years, you look at people who are ahead of you 10 years on the gap. You look at them. If you don't want to live that kind of a career lifestyle, don't do that. Start asking a lot of questions. NAWEC was a no thing. Gambia Petroleum was a no thing. And I was like, Gambia International Airlines was a no thing. And I was like, okay, do you know what? Let me go and study something and work outside. Gambia itself will be a no thing to me. Then I had that belief and I made research. What is the most effective job ready market outside their career that is job ready? Once you got it, you will get a job automatically. Then I come to realize, okay, this is from the internet. Then I come to realize artificial intelligence is one of the future. It's one of the biggest things at the end of the day. Then I connected that to one thing that okay, anytime you want to become exceptional in what you do, you don't have to see what all the average is see. That's just like the average mindset. And up to today, AI, we don't have AI as a program in the whole entire University of the Gambia. Up to today, we don't have AI as a course. So, again, from my conversation, if you're young, you're not bold enough to think big. Where will you think big? You see, if you get to a certain point in your life, you don't have time to think. You are busy with executing. Responsibilities left and right. So again, this is where we have a problem. And this problem, we will never solve it as a country, except the University of the Gambia, the highest tertiary level of institution, the mindset change. And it has to start here. And the way students think in this university, I was a university student before, so I definitely know. I've actually studied here, I've actually studied outside. Even the way people think is totally different. And all of those mindset needs to start here. And one of the biggest arguments that I do argue, I know it has nothing much to relate to this topic, but it has something to do with mindset. See, most of the student union body that we have every single year, we will all support them, we will all champion them, we have issues. You will never see them. And the moment they are literally stubborn, bam, scholarship, they travel, done. This is something that you can repeat over the last 10, 15 years. So that has something to do with your mindset. But let's shift that back to career. How will you make sure that will definitely help you? He asked a very, very important question that needs to be addressed. But again, it was not being addressed at the end of the day because it's only entrepreneurs that will address that. Let's say most of you guys graduated with your degree in public health. And you'll be like, you're thinking of the directorate, you're thinking of the Minister of Health. That is a wrong perception for you to think. I'll just give you a simple example. With APS, they are fintech, right? Good. They entirely, what do we use? What is the product that they have that we are using? Is it not technology? If you check how many people build that app, they're not more than 10. If you check the number of people that we have employed, now it will be definitely more than 500. So only 5 people or only less than 10 people build a product that over 500 people have been employed to push that product. How many people are using Wave in this country? We could comfortably say more than 100,000 people are using Wave in this country. So what does that has to tell you here? It's not about what you study. It's not about the document that you have at the end of the day. It's about how do you approach solving problems. That is the most important thing. And you approaching solving problem, critical thinking, You don't need a degree to demonstrate critical thinking. Listen to that again. You don't need a degree to demonstrate critical thinking. For the third time, you don't need a degree to demonstrate critical thinking. Why did I elaborate it on all of this three? There are university students that I know my very self. They've been paid more than $50,000 a month. They are still students. Any student that is definitely working for banks or for fintechs, they are definitely receiving more than that. Meaning fintech. I know I am an employer. I definitely know. I actually employed more than 26 staffs, so I definitely know what is happening in the market. If it's not for confidentiality sake, I will even call people in this universe that's earning more than that. Then definitely those people are earning more than their lecturers. Because I definitely know how much some of the lecturers are being paid. So again, why am I telling you this? It's to emphasize on the point that I told you. There's nothing like perfect time in career. Entirely. Until last year, all of my staff, no one had a degree except me. Until last year, I think last year's batch, don't contact as a batch. Until last year's batch, the whole entire company, no one had a degree except myself. And over the last, we started 2021. We've built 3 entire companies. Go Mines Academy, and now Modern Pay. And I am telling you, until last year, I was the only one with degree, the whole entire company. And we have definitely won one of the most amazing projects from the government directly. Early warning systems. It's from the office of the vice president. Now I ask myself the question, do they ask us for our degrees? See, these are the questions that university students will ask themselves. So if that is the case, then what excuses are some of you guys having, not even interning, talk less of having a job? What do you have to show for yourself if you remove that degree or that transcript? What do you have to show for yourself? And lastly, on this part, I want to end it up with this. And if you think right now, you're competing against each other, you're fooling yourself. You're competing against technology. And you definitely don't stand the chance. When was the last time most of us went to queue for cash power? What happens to those people who were selling cash power? When was the last time that we bought credit at the shop? And worst of all, the wave that is coming, it will be tough more than any other time. Fuel last week, 112. And that's the energy of the economy. Anything that will move from one point to another point, request, wow, energy. And you know why? This is a burden, not even, if you think it's a burden on you, the government is suffering more than us. Subsidies, $500 million is a month. If the government removes the subsidies, we will not be paying 112 per liter. We will most likely pay $150 per liter. So the government is subsidizing. And they are telling us 500 million per month is not sustainable. And if you think those people, they are so much bothered of employing all of you, you're fooling yourself. They have their own problems to think about. So at times, it's the mindset, it's the people that you hang out with. It's what you definitely needed to know. So again, on that part, this is what I have to tell you. Some of you people who are waiting for you to be employed. The research, the ball is in your court. So if you're comfortable about it, I've just gist you according to what is definitely going on. How about on the other people who be like, okay, do you know what? I'm not waiting for anyone to employ me. I am definitely taking this upon my responsibility to do something about it. Your first step is this. Identify ASAP as much as you have the time. Even if you are definitely interning at that place for 2 days, 2 days, a month, like 2 days a week, it's totally fine. I am not telling you this just to tell you this. I am telling you this because of I definitely know exactly what I'm literally doing. Modern Pay, we have our PR and communication officer, Zahra Biri. She's a nursing student. Do you know how many hours she spends at the office? In the whole entire week, she only comes 2 days a week. She only spends at the office 2 hours. Do I have a problem with it? No. Get the work done. Wherever you are, I don't even care. That's it. She's an entrepreneur. She's doing pretty well in the agri industry. She's doing amazingly well. She's selling a lot of products. She's doing influencer marketing. And she's a nurse. And she's also our PR and communication officer. 4 jobs. And guess what? I think she's in her second year of nursing. Yeah, she started, I think, last year. Second year. So don't be too comfortable thinking you still have time to figure it out. And before we even a prime example is definitely Ahmad. He actually started working way before even he got to university. And right now, some of his product that he put out there is one of the most amazing products out there. So again, for people who are definitely not waiting for them to be employed, start with asking yourself hard questions. And try to ask as much as possible and see people who can answer those questions. Then that is alignment. You are aligning with those people. Those people definitely have answers for your questions. And if those people have answers for your questions, see how they are doing it and try and learn from them. And as much as you're learning from them, you will not only learn just the basics. One thing my professor used to tell me is this: anytime you have an opportunity to work somewhere, never work for an established company. Do you know why? If you work for an established company, the few things that you would definitely know is just a task being given to you. You do this and then you do it, it's done. But if you work for a startup, you will literally do every single thing. Communication will be involved. All the soft skills, you will do it. All the hard skills, you will definitely do it. And along the line, you will learn what entrepreneurship is all about. And whilst building this, we've built actually 3 companies that I co-founded directly, but those are not the only companies that we definitely built. Other staffs along the line, they also build their brands, they build their companies. One of the famous that some of you guys might know is Content Graphics. This guy built it from scratch. Once he was in university, he graduated last year. So along the line, he learned from people who have definitely been in the journey. This is how you learn. It's not magic. It's not rocket science. If professors knew about every single thing, why didn't they discover a lot of these things? No. So they don't. They have their limitations. But that is totally fine. But of course, if you're into academics, that's totally fine. Follow literally everything that they tell you. Don't even ask. Finish your degree, get to do masters, have the opportunity to do PhD. Then you come back to this country, you have only 2 options. You're being underpaid, or you join the government and do your things. And life moves. We know, because we are in the private sector, we know what happens. So again, some of you guys should not be blinded with those things. And my last advice for entrepreneurship is actually relating to technology. Entrepreneurship has never been easy more than this time. You see, in every business, you only have two functions. You are the seller or you're the builder. Selling and building. Making the product or building the product and selling. These are the two main functions of business. So if you know you're good with selling, find a co-founder who is good with building. If you have a public health idea here, you have this idea and you're so much into this idea, don't even worry how to make or how to build. Get a computer science student, co-partner with them. Let them be your co-founder, you establish it. It's as simple as ABC. It's that difficult. It's not rocket science. But you see, we cannot think about it because we are not being taught about entrepreneurial. Even in school, we're only being trained how to work for someone. And when I do make it very, very clear, every single entity that we talked about in this country, you talk about Ja Oil, who comes to your mind? Hamidou Ja. You talk about, the Q Group, who comes to your mind? Mohamed Ja. Do you talk about other individuals? So I told my staff, during our time, if someone is talking about gold mines, they don't only talk about Mo. And this is something that we are so intentional about. At the University of the Gambia, you will ask million times, whosoever didn't come to government, you stand no chance to know me, 100%. But you stand the chance to know Conte. Fix 100%. You stand the chance to know other people. You stand the chance to know Kausu. You stand the chance to know Bailo. And then the rest of the team. You stand the chance to know Fanmata Dansu. Even if you don't know Fanmata Dansu, publicly online you might definitely see her doing her activities. So this is what we need to build in our generation. It's not one specific individual controlling the whole entire wealth. So definitely I will stop it there, and then if you have some questions, please ask.
At the end of the opening on Friday of SAPEH Week 2026, I would like to say a very big thank you to our speakers and the organizing committee for making this event happen. I hope we all believe that public health is not just about academics, as we all learn from our different speakers, right? So I hope what we have learned today here will take it forward in our future and in all our ways. And I hope we all have got different things here from the government academic to develop. Thank you so much on behalf of SAPEH and the Board Executive Council. We are saying a very big thank you for those advices that you have given us. And also to all my fellow students, we are not much here. Though the program was really good, I really appreciate all of you for being here for your